Hi, I'm Frederik Zimmermann. I'm from the Catharina Hospital in Eindhoven in the Netherlands, and I will talk about the quality of life analyses of the FAME3 trial. So previous studies have shown that revascularization improves quality of life, more so after CABG than PCI. However, previous trials did not use FFR-guided PCI and did not use second-generation drug-eluting stents, both which have been shown to improve outcome. For that reason, the FAME3 study was conducted, which was an investigator-initiated, multi-center, international randomized controlled trials in 48 sites worldwide, comparing FFR-guided PCI with CABG in patients with true vessel disease. As presented by Dr. Fearon last year at TCT and also published in New England Journal of Medicine, PCI did not meet non-inferiority with respect to MACE at 1 year. However, if you look at the event rates compared to previous trials, then the event rates are lower and the differences between PCI and CABG narrowed. So in light of the smaller differences in event rates, the quality of life, angina status, as well as working status becomes much more important for clinical decision making. Yeah, so for this quality of life analysis, our primary endpoint was the EQ-5D summary index at 1 year. We assessed quality of life at baseline, 1 month and 12 months, as well as the visual analog scale of the EQ-5D. Angina status and working status were also assessed at that point, but also at 6 months. We found that the quality of life at 1 year was identical between the FFR-guided PCI group and the CABG group. However, FFR-guided PCI resulted in faster improvement of quality of life. Also found that the angina was dramatically decreased over both forms of revascularization, with no differences at 12 months, and patients in the CABG arm worked less at 1 month. Interestingly, if we looked at a pre-specified subgroup analysis of patients younger than 65 years old at time of randomization, we found that patients in the CABG group worked less at 1 month, but also at 6 months and 12 months. In light of the low event rates, it's all about shared decision making with the patients, and we now have the data. We're very confident that the quality of life improves faster after FFR-guided PCI, with no differences also with respect to angina at 1 year. It will also be important to look at longer follow-up, so we will also follow patients for up to 5 years. We will do the quality of life analyses at 3 and 5 years. I have to say, though, that in previous studies such as Syntax and Freedom, the main findings did not change that much beyond 1 year with respect to quality of life.